Bonjour, hi. My name is Vincent Martin-Schreiber, and I am going to present a project I am working on, which is about availability and access to language minorities data available across Canada. When talking about official language minority communities, it is relevant to remind that language barriers are one of the key components of access to healthcare. It has been demonstrated in several research works, including the one cited here from Demoissac and Bowen 5 years ago. They estimated that 20% of Francophones in minority situations in Canada do not access care because of limited access to language concordant care. Despite this situation, researchers who studied the availability of language variables found out that they were inexistent in a lot of datasets. This is, for example, the case in the province of Ontario, where only about a third of health services datasets include some information about patients' language. In addition, there seems to be some difficulties in accessing data in a timely manner for research purpose, with differences between provinces. There is a project run by a team led by Cynthia Kendall at the Dalhousie University in Halifax, which is being done, and this study should provide more insight on the factors impacting the time to access data when the results are published. The project we are working on has been built from this situation and has four main objectives. The first one is to consolidate a network of professionals in the area of access to healthcare and administrative data access in provinces and territories, and also at the pan Canadian level. The second objective is to update the linguistic variables inventories from the latest information available. The third objective is to determine the language concepts in the data currently available and to make an analysis of the language variables and how they are defined. Lastly, our team would like to build some tools that can be used by researchers on the topic of language minorities. For example, for those who work on the topic of access to care, or those who would like to compare outcomes for populations based on languages spoken. For this first objective, we are aiming to connect with a wide range of professionals in all geographical areas. This includes researchers and librarians interested in the topic of language minorities and data access. It also includes data stewards in provinces and territories, for example, ICES in Ontario or MCHP in Manitoba. It also encompasses pan-Canadian organizations such as HDRN, which offers services to ease access to medical data in Canada for researchers. Kaya High, which has activities around, having like common indicators in Canada, the Digital Research Alliance of Canada, and finally the Federated Research Data Repository. For the second objective, we identified a wide range of databases of interest at all levels in Canada. You can see on this slide the main organizations we are targeting, and you may notice that they are almost the same as for the first objective for building a network of contacts. Our goal is to gather information about as many datasets as possible and to collect data about the data based on the template we prepared. Whenever possible, we will try to collect data dictionaries, especially if they contain rich metadata about the variables. Once we have updated information about the language variables from the different medical administrative data sets, we will work on updating the information we already have from previous publications in terms of the definition of languages used and how they compare. We will also be able to get a full picture of the current landscape from coast to coast to coast. More specifically, we will conduct reliability and validity analysis of language data to identify linguistic groups, Francophones, Anglophones, and Allophones. Before we talk about the toolbox we would like to build, I wanted to remind briefly what metadata are, as it is a key concept that we will discuss with the toolbox. A quick definition of what metadata are is that it is basically data about the data. So anything you can say about the data. Um, if you have a look at the definition of Eurostat, which is a bit more precise, it tells us that metadata describe data by giving definitions of populations, objects, variables, the methodology to collect the data, and quality. So it's really to guide the person having a look at the data set about the variables there, the values they can have, the data quality, the dates available. One tool we would like to build for our researchers toolbox on this project is a metadata repository. This is basically a data index and search engine that uses the metadata extracted from a collection of repositories, typically the ones we saw earlier across provinces or at the pan-Canadian level with Kai or other data holders. This is really a solution that could benefit everyone, and not only for people doing research about francophone minorities, as there is a need in Canada to have access to where the data are and what kind of data are there, the data quality, the years available, etc. And today, this type of tool is not available for the medical administrative databases in Canada. One example of such a metadata repository is called Meteor. It is done in Australia by the equivalent of HDRN, and they actually have a partnership with HDRN in Canada. And they gathered a lot of metadatabases from their different regions, which are not called provinces there, and from a lot of different ministries. So if you want to search that metadata repository, let's say, for example, you are looking for the language spoken at home. Obviously, you would not only look for that, but this is only to give you an example. You would have the results here, 60 results. And if I want to find data elements, which are for them the variables, you can find the list of variables. And on that first one here, you have a lot of information about the data set where that specific variable is, how it is collected, the value types, the type of values it can have, English or other, which is very restrictive in this situation, and where you can find it. The way those platforms work, those metadata repository, is by having a workflow where the platform is going to either pull the metadata from the data providers, or those data providers are pushing the metadata to the platform, and then it does create them inside the platform, and then does like a lot of possibly data transformation and quality check, store them, and build the data catalog with search capabilities, with either or API so that external system can access them, or directly on the web via a search engine, search mask similar to the one we saw with Meteor in Australia earlier. This concept of metadata repository is not new for the technology industry. As we saw, this platform we are thinking about is coming from LinkedIn in the Silicon Valley. It is less common to be used in settings like in healthcare for the metadata or the medical administrative databases. But there is definitely a trend worldwide to try to go towards having some form of repository where researchers can find data sets and even better variables with their metadata, their description, etc. One of the other tools we are considering for toolbox is to switch from the frequencies to the Bayesian statistical paradigm. That would allow to leverage other sources of data without having to do any form of data linkage. This is, for example, the community surveys from Statistics Canada or the census data from Statistics Canada as well. And that would maybe allow researchers to decrease the time to results when studying a phenomenon. So there is a wide range of methods available. There are, for example, Bayesian networks, Bayesian hierarchical models, which can be used depending on the purpose. In conclusion of this presentation, this project will be a key contribution to update the current knowledge about the data availability regarding languages across Canada. Some of the tools we are trying to build could change the way researchers can access data by making datasets easier to find, and also by using methodological alternatives by leveraging Bayesian statistics. Altogether, we hope to contribute to building a more adapted care access to language minorities in Canada.